Now, let's address some technical challenges around implementing AI. Implementing AI in a clinical or a hospital environment can certainly present a myriad of technical challenges. Here are some of the examples that are really nice to be mindful of. Number one, patient privacy. Consent for data use is imperative. Even if the data is used for training AI models, informed consent from patients is vital. They should be made aware that their data is being used, even if it is anonymized, and for what purpose. Anonymization. Even when using patient data for AI training or analysis, identifiable information like names, addresses, birth dates, etc., should be stripped away to protect patient identity at all times. Data security concerns. Encryption. All patient data, whether at rest or in transit, should always be encrypted to prevent unauthorized access. Access controls. Strict controls on who can access the data and AI models should be in place well before any data transfer has begun. With robust authentication and authorization mechanisms, this is a great way to mitigate the chance of any breach of patient confidentiality. Consider regular audits. Periodic security audits can help identify vulnerabilities and ensure that data is protected against breaches. Now let's discuss biases that can be possible in the world of AI. Data representativeness. If the data used to train AI isn't representative of diverse populations, the AI can develop biases. One example of this is if an AI dermatology tool is primarily trained on light-skinned individuals, it might be less accurate for darker-skinned individuals, as an example. How about algorithmic transparency? You see, it's crucial to understand how the AI makes decisions. Black box algorithms where the decision-making process isn't clear can lead to real ethical concerns and challenges. Continuous monitoring. Even post-deployment, AI systems should be monitored for any biases that might make themselves apparent. Regularly testing the AI on diverse data sets can help catch and rectify such biases. Let's discuss legal considerations that you must be mindful of. Regulatory compliance specifically. Now, depending on the region or country, there might be specific regulations around AI in healthcare, especially concerning patient data. Being able to ensure compliance with HIPAA in the US or GDPR in Europe or other local regulations is quite frankly essential. Liability. In case of AI errors leading to misdiagnoses or treatment errors, it's vital to define the liability. Is it the healthcare provider, the AI software developer, or someone else? Transparency with patients. Patients should be made aware when AI tools are being used in their diagnosis or treatment. And patients should have the right to opt for human-only decision-making at any point in time. Now, let's discuss the ethical responsibility and human oversight in the world of AI. It's important that when discussing the ethical responsibility and the intersection of that with human oversight, that it be looked at as a complementary approach. You see, AI should ideally play a complementary role to human expertise. Relying solely on AI without human oversight can be ethically questionable. Ethical use of AI. Just because AI can predict certain outcomes or conditions doesn't always mean it should. For instance, predicting terminal illnesses without a therapeutic course of action can lead to a series of ethical dilemmas. Ethical and legal considerations aren't just checkboxes to tick. They are foundational to understanding and ensuring that the integration of AI in healthcare is done responsibly, transparently, and with the best interests of patients at heart. Now, that's all for this module on the challenges around implementing AI. We'll see you on the next one.